We'd like to call a special meeting of the City Council to order at March 27th to 19th p.m. We're going to dispense with the verbal roll call of City Council. Those that are here. Can you hear me yet? So, okay, we're going to dispense with the verbal roll call, and the clerk will... Is that going to work? We'll get this right here.
Should have did testing. You can hear us?
Look, how's that work? That's working better, I think. We're not getting the feedback. Everything's good? Yep. Thumbs up back there. So that's going to move us into, would you please rise and participate in the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. So under communications, I think it would be appropriate that we would start with introductions.
I'm Sherry Bullard. I'm Tina Williams.
Sister Andrea Nenzel.
Bill Tatsuda.
Russell Cockrum.
I'm Ken Owen.
Ed Freisinger.
And Alan Christensen. I'm the chief of the medical staff over the hospital.
Dave Johnson.
Who else do you have in the audience?
We have two other board members in the audience, Ron Saxton and then Carl Amelon are members of our board too. Oh, and then Dr. Rice.
All right. And then, of course, go ahead, Carl.
Carl Amelon, city manager.
Dick Coos.
Mark Flora.
Janilee Gage.
Sam Bergeron.
Judy Zingy.
And I'm Bob Sievertson. And welcome, everybody. Thank you for showing up here today and working on this project with us. And so at this point, we'll move into persons to be heard. And the first one I've got is Carol Egner. Carol. Yeah.
Am I supposed to grab it and drop it?
Whatever you need to do with it. Take it.
It's like, make it short.
You're bigger than you think.
Thank you. Maybe that's too short. Okay, so I'm Carol Egner. No, it's fine. I don't often go out and speak into microphones. I've lived here most of my life, or I've lived all of my life so far in Ketchikan. I don't think that you have enough time to hear all of what I have to say, so if someone wants to hear something more, because I can barely remember, I wrote things down, I have notes this high from the last few years. After my husband Harry Egner passed away Thanksgiving 2016 at our house, after a terrible stroke, I have to say that I am a big fan of many, many people who work at the hospital underneath PeaceHealth, individual people. I'm not fond of the people who said, I might not even make it through this, I might have to leave, but excuse me if I do, because I don't know. People who said to him, oh, you're probably never going to walk again. You may as well figure that out. These are doctors. And I'm a pretty good advocate. And I'm actually realizing today that I am angry, hurt, anxious. I worry about other people who don't have advocates. And I can't volunteer for everybody. I didn't do big written complaints. I complained at the time when we were going through hell, which never was relieved until he died. Although Dr. Sanders was amazing and very kind, and many other people with home health and whatever, but you know, we didn't really get any real help for what was going on. And unfortunately, he didn't get medevac. He had this happen when he was working out of Juneau. So he ended up in Bartlett, and it was just about as bad there, I'm sorry to say. And what it really bothers me, besides all the details that you don't have time for, because it's like you'd probably have to sit with me for several days. What bothered him and what bothers me now is that I feel like many people aren't getting the right care because of the system. And I don't really understand the whole system because I was just, sideswiped into the whole thing. And I realize other people are too, and they're afraid to talk about it. People are afraid because they don't want to blackball themselves from the system. And, people's emotions get hurt. It's pretty hard to handle. You don't sleep for 2 years and you're taking care of someone yourself who's bedridden and can't do anything themselves. And to have people, within the system, very few people said, you'll never walk again. You'll never do this again. You may as well just face the fact you're dying, buddy, I just still can't forgive someone for that. It's like, what the hell? And so, my language might deteriorate too. I think it's a big problem, and it's a personal problem for me because I'm afraid I don't want to go to the hospital. I don't want to go there. I will. My daughter-in-law is having a baby probably today or tomorrow, and I don't feel that way about her going there. And but there's that other part of me, like, oh, if something really, really bad happens to you, you're going to suffer. And I'm usually a pretty easy person to get along with. I say that, that's a self-diagnosis. But I just feel like something happened from in the old days, which was like a dozen years ago maybe, not the same anymore. And so, like my daughter-in-law's grandma, she had to go to she's really old. She had to go to her doctor, and he wanted her to go be admitted to the hospital. He can't admit her to the hospital. She has to go to the ER first. That's BS, in my opinion, but I'm not in charge. So she went through hell, and I went down there with him, and I just said a few things to the doctor, and actually he listened to me. And I'm like, why can't my doctor admit me? This is what bothers me too, for my own self. Why can't my doctor admit me to the hospital if I come to him or her and I'm needing to go into the hospital? I have to go to the ER first? My husband was in the ER many times during this course of nasty events. He was in there for a suicide watch, one of the last times he was there. And he was in there on this big high gurney or whatever you call it, the bed in the padded room, I call it. It's not really padded, but that's what I call it. And I was there keeping him from falling on the ground. And nobody was helping me. And then one of the other nurses from the clinic called me and said, why are you still there right now? And I said, because if I'm not, he'll fall on the ground. And she said, well, they should do that. They should take care of that. And I said, but they're not. I can't leave. And I didn't want to leave anyway. But it was just like, I have lists, and I also write the good things about the people that were so helpful and wonderful. And it hurts my heart to think of other people ending up in some terrible situation like we ended up in and having no help. If it hadn't been for our kids and some friends, I don't know, I could have expired myself. And that's not exaggerating anything. And so, it took me, I don't know, after he died, I slept for 6 months, I swear. People said, did you get drugs? I said, no, I don't want any part of it. I don't want any drugs. I don't take any drugs. I'm not taking any drugs from anybody. I see them ruin people. So I have a bad attitude, and I'm afraid that you could multiply me by a lot of people I actually know of, and probably some people I don't know of at all. Because even though I've lived here all my life, I don't know everybody. And I hate to see people suffering like that. And probably it's the insurance, it's a lot of things, but for me to go into my own hospital in my own town where I was born and have those kind of horrible experiences, is unconscionable. It's a horrible thing. And, you know, most times people don't have that kind of experience unless they've got something terrible. And we had hell. And there wasn't much help. There were people who wanted to help, but they couldn't. They couldn't help us. And that was, I think it was 18 months is how much time it went from the beginning to the end. And yeah, that's my big distressing thing. And every day I think about it and I pray about other people if they're, you know, going to the hospital, you know, like, oh my God, I hope they don't get what we got. And, or we didn't get, you know, they didn't get. I mean, the best thing Harry got was Sister Arnadine Bean, and so I'm glad to see you here. I wanted to change my name to her name. It's the best name ever. So I think there's a huge amount of space for improvement, and I don't want to be totally negative, but we had, you know, 88% negative out of our entire experience, and that's probably given the hospital a little bit more than I should. And I have it all written down in big piles of stuff. I wrote everything down. I charted everything. I used to be a CNA, you know. I chart everything. And, you know, the negative comments that people make who work there, who actually work there, who are nurses or doctors, whoever, maybe they should have a training. And I spoke with you on the phone at one point here, so I see who you are now, so don't worry. I just have, I have post-traumatic stress over it, and I've just begun to realize that, you know, and I don't want anyone else to have that happen. And people go, oh, that wouldn't happen. I say, I didn't think that would ever happen to us, ever in a million years. If you have a big, bad stroke or some other terrible accident or something, throw you out, they'll throw you out, you know. I mean, in Juneau too, Bartlett, same thing. Oh, well, you've got to be out of here in 2 days. I'm like, okay, then the other thing, and then I'll just stop, because if you want to ask me a whole bunch of questions, I have a whole lot to say. And I could, but this is not my best. I'm trying to get away from the microphone. It's like, now I'm going to forget. It's so overwhelming that you think people going to the hospital, they're getting help. And I found that that's not always the case at all. And I had to stand my ground there and say, he won't be discharged. I had to sit there for 5 days, once he got admitted, demanding that he get to go to long-term care and have PT and stuff instead of just 2 days with home health. And I don't know exactly how they said, well, you'll have to pay $10,000 or $12,000 a day for every day that you sit here. And I said, I don't care. Try to bleed it out of me. It doesn't really matter. Just look at us. It doesn't really matter. It's a terrible thing. Harry could talk, which we joked around about. He said that's the good thing and the bad thing. And some reason he didn't lose his voice. But I don't think it was the best care in many ways, and especially some of the attitudes. And at least Dr. Sanders sat with him and talked to him, came to our house and sat with him and listened to him and treated him with kindness and answered his questions about why couldn't Dr. Sanders help him die? And he didn't just shut him down and leave, you know, he sat there and he talked to him like a human being, and all the rest of the stuff was, you know, pretty horrible. And that's my experience, and some of it's just too awful to even, you know. And the wonderful stuff about the people who work there, PT, nurses, doctors, I mean, you know, there's a lot of good stuff there, but when you run into that and you're in misery, that's a pretty horrible thing. And I'm sad to say that that's what we ran into. And 5 days, I thought, oh, well, that's going to be $50,000 I'm going to have to pay. And I told the doctor I didn't like him and I didn't want to have him, and Harry didn't have to have him because he was no good for us. And I demanded another doctor. They said they didn't have one. I said, well, fine, then we'll die in this room together without a doctor. Thank you very much, and I wouldn't let anyone in.
Thank you, Carol.
Yeah. And if you want to ask me any other questions, personally, I'm still living in Ketchikan.
Thank you. Mimi Copper.
My name's Mimi Kotleroff. I've lived in Ketchikan for 53 years, I think it is. I've been to a lot of hospitals in my day. I've been to Kaiser in California. I've been to one in Bath, England. I've been to PeaceHealth in Bellingham. I've been to Virginia Mason and Swedish. That might be all of them. And I think our hospital's doing a pretty good job. My experience here has been really good. And I find the place clean. The wait time's almost nothing. All those little things that make a visit, just either irritating or good, seem to be okay with me. I think we've got a big, beautiful hospital in a tiny little town, and we should probably be really grateful. You don't have to go to Seattle for a whole bunch of tests anymore. We've got imaging, we've got all these machines that do all this stuff. I mean, I was here when there wasn't a mammogram, and the surgical unit is great, and they even do infusions here, which for us is important. So I just wanted to say that if there's a problem, like I hear a lot of people talking about billing as a problem, and my husband and I had a little problem with billing. I mean, it wasn't a big problem. It was like $39 or something, but we didn't understand it. And we went up there, and they're checking it out for us. So I think if there's a problem, focus on it, try to solve it. But at the same time, we have to be grateful for this big, beautiful hospital that is way big. I mean, I understand kind of why we have it. They're probably really busy in the summer and they're not so busy in the winter, but still, it's a wonderful, wonderful thing, because it would be awful if my husband and I had to fly to Seattle for infusions every 8 weeks, I mean, it's really nice. So I just wanted to say, keep it up. Thanks.
Thank you. R.K. Rice.
Hello, I'm R.K. Rice. I must say that first that as she said, this is an amazing facility for us to have in a town this size. And I want to thank all the people who have worked so hard over the years to make improvements and continue to make this a really great facility. My daughter was born there 35 years ago. It was cesarean, everything was fine. I've had a couple bones set there over the years. But now comes the but. The last quite a few years, I've had a few very, very bad experiences with PeaceHealth. One is, I'll try and as quick as possible. I fell and hurt my shoulder. Got an appointment with the doctor there. He gave me exercises to do and said it was going to really hurt, but that's the way it is. You got to man up or whatever. Then I ended up coming in later because it was actually getting worse, and I got an MRI. And then about a month later, I finally called the hospital, and I said, "What's up with the MRI? I haven't heard a word." And the nurse said, "Oh gosh, you haven't heard from us? That's not right. So we'll get back to you next week." This was late in the week. So I waited another week, and I call again. "Oh gosh, this is really awful." So she said, "Okay, I'm going to go wait outside the room where he is with a patient now, and I'm going to make sure that he calls you back." So he called me back, and he told me that the surgery I needed, I would be in a sling for a month. I would be in physical therapy for 3 months, and then it would be about 3 more months of just exercise before I was healed. I went to a doctor that my brother and nephew had gone to down south. The operation was on Friday. Saturday morning, the anesthetist calls me to check on me. The doctor calls me to check and see how I'm doing. The doctor questions me and he says, get rid of that sling. You don't need that. This is not 30 days. This is half a day. So then I had physical therapy for 2 months, and in about 3 months from the time I was 100%. So this didn't do anything for my confidence in this particular surgeon. This person is not there anymore. My wife had a situation where she ended up, after over 4 years of being seen here for a real bad GERD and acid reflux. We happened to be in Portland. She was getting stomach things, and when we got her to the hospital just in time, she was in intensive care for 9 days with acute pancreatitis. There were growths, I can't remember what you call it now, on her pancreas caused by the different antacids my wife had been taking all these years. So those are two fairly reasonable incidents. And then one other thing I wanted to mention, and I really believe a lot of this is administrative. I don't think, I think we have a lot of really good, really competent doctors and nurses and people working there. But 2 or 3 years ago, and I don't recall the exact time, but PeaceHealth eliminated the triage nurse. And, you could call up and talk to a nurse, say, okay, this is happening, I'm feeling this and this and that. And the nurse would say, okay, take your temperature, do this. If this happens, then you better maybe get down in the emergency, but I think it's okay or whatever. And that was a great service, and that was eliminated. And I think one of the reasons that the nurses are maybe overworked is because they have to be the triage nurse and call back for where they're pretty busy working with their doctor that's a specialty. So, like I say, I'm grateful to have this hospital here and for all the people that work so hard at it, but I think it really needs some improvement. And the triage nurse is to me, whatever is saved in wages, I think is really lost in care and service. So thank you for listening.
Deb Davis?
I think it's tall enough for me. So I want to give you two perspectives. One is, those of you who know me, I've lived here since '99. I went to work for PeaceHealth that same year. I worked in the intensive care unit for several years and was given the opportunity to do infusions, chemotherapy and infusions for other things. So I want to split my experience as an employee and my experience as a patient into two separate categories. Because one of the things that matters when you are an employee of a facility is you want to know that they're watching over you, they're taking care of you, that you're getting paid fairly, etc. All of those things. So as an employee, I always felt supported. When I had a problem, I had someone to go to. Did everything get fixed in 5 seconds? Well, maybe not, but it did get fixed. The facility gave me the opportunity to start that infusion clinic as a now 5-day-a-week infusion center, which is not where we started. We started from one patient here and one patient there, 1 day, 2 days, okay? They gave me that opportunity to do that, and then to bring in people so that I could retire, so I look like the rest of the retirees, right? You don't always see that, and for those that know me know that I came out of the military system. 22 years active duty military hospitals. I had not quite that much control over my future. PeaceHealth gave me that. They ensured I was supported and my clinic was supported and that we had all the people we needed. In addition, you have the foundation, you have people fundraising. The whole way we got that clinic was fundraising because there was asbestos in that room, which meant it had to be stripped to the walls, to the studs. It was nothing there between what had to be mitigated and rebuilt from nothing to what we have now, and new equipment and new supplies. And we didn't have to scrounge anything. We had all the stuff we needed when we opened that clinic. It's pretty darn amazing. Most of the woodwork in there was done by our own maintenance guys. They didn't just buy stuff, they fixed it, they made it fit. We even had a person putting things on the wall so that it looks like art belongs there. There was a lot that went into that clinic. So as an employee, as a supporter of the patients that are seen in that clinic, I think it's the best thing I've ever seen. Now let me talk to you about being a patient. Like most of us, I ended up being a patient a couple of times. First time was back in the early 2000s, where I had what was supposed to be a minor procedure that proceeded to become a bigger procedure, not for anybody else's fault, just because of the way it was. I landed in the hospital for like a week with pulmonary emboli because of what happened internally, what's going on internally. I was always well treated. I always felt supported. I actually had nurses that didn't know me, which is probably a good thing. So I never felt like I had preferential treatment, is what I'm saying, just because I worked there. Then I was safe for a while. I didn't have to go anywhere. But then just recently, 6 months ago, I had my knee replaced. VA would have sent me anywhere. I could have gone wherever I darn well pleased. I chose to stay here because I believed in the physician that took care of me, and the staff that took care of me, and the physical therapist that took care of me. I could have gone to physical therapy out of the hospital. Wherever the VA, wherever I wanted, the VA would have sent me. But I wanted to stay, 1, in town, 2, with people that I knew the system and I knew the support that I would get. And lo and behold, I have a knee that works, which I just came back from 5 days on a dog sled out in the Denali Highway. I think it works pretty good. Okay? Now, does that mean that there aren't things that need to be better? Always. There isn't an organization ever that doesn't need to work on stuff. One of the things that happened to me was a billing thing. I got a letter from VA saying, we're not paying this. A letter from PeaceHealth saying, we billed somebody else. I'm like, well, yeah, you billed the wrong folks. So I had to spend a little time on the phone. I did. They fixed it. I never heard another word. I can only tell you that there are always things that can be improved, and I think the people want to do the right thing every time. I believe that with my whole heart.
Thank you, Dave. Judith.
Good evening. I'm Judith McQuarrie. I am a member of the Borough Assembly, but I am not speaking for the Assembly. I'm speaking only for myself. Thank you. I've always had good treatment at Ketchikan General Hospital. I got a bill today from PeaceHealth. It was the first one I've gotten that was actually understandable. I can tell exactly what insurance paid and what I need to pay, and this is the very first time. My husband and I have been frustrated, especially by the billing system at KGH, which I still call our hospital Ketchikan General Hospital. I don't care about PeaceHealth Corporate. PeaceHealth Corporate seems to see me as only a revenue source. I don't think PeaceHealth Corporate cares at all about us in Ketchikan, but Ketchikan General Hospital does, and I appreciate that, and I like have my medical care by my friends and neighbors. It makes me feel good about that, but I don't care at all for PeaceHealth Corporate. I was at my physician's office getting some other things done. And I thought, while I'm here, I think I'll see if I can get a flu shot. No one could tell me what a flu shot was going to cost. Not one person. I ended up going to the free flu shots at the high school about 2 weeks later, and I'm awfully glad that I didn't get my flu shot at the hospital, because I think it would have cost me a whole lot more money. And that's pretty much all I have to say. I think that things are improving. It really bothers me that I don't think PeaceHealth corporate cares at all about us. I really objected when they spent the money to change all of the letterhead, to change all of the signage. We already knew that Ketchikan General Hospital was part of PeaceHealth, but why waste all that money, our money, to do a cosmetic thing that is meaningless and in fact detrimental to us in Ketchikan? So that's what I have to say.
Thank you, Judith. Margaret. Margaret here? Yep, here we go. Margaret and Company.
Yes, you get two for the price of one today. Hi, my name is Margaret Bethel. I'm a doctor of physical therapy, and I'm also a certified lymphedema therapist. I was born at PeaceHealth, Ketchikan General Hospital, as Judith said, and so was my daughter, Alexis. I wanted to share with you a little about the reason why I'm here today in Ketchikan is I'm a K-High grad, lived here my whole life, and when I went to school and wanted to be a physical therapist, as I said, I'm a doctor of physical therapy, so it's a lot of school, and it's expensive. And I was able to, I was able to get a scholarship through our hospital here, a community scholarship that funded me through my 3 years of physical therapy, doctor of physical therapy school. That allowed me not to have to take out extremely expensive grad plus loans. That allowed me to attend my internships in various places across the country, and allowed me to come back home where I didn't have to take expensive, a lot of therapists when they're right out of school will take jobs as travelers, and just to make the amount of money they need to pay back those loans. So I was able to come back here. I was able to have enough money to purchase a house with my husband and raise a family. I also, part of the letters of my name, I'm a certified lymphedema therapist. So PeaceHealth supported me in getting this certification so I can treat patients who otherwise would have to go to Anchorage or Seattle. Patients who have already gone through cancer, who already suffered a lot, and now they have a debilitating lifelong issue of lymphedema. Patients that have non-healing wounds because their body is producing too much fluid. And there was a need that we didn't have a person here to treat those people. That really, really bothered me, because I don't like knowing that my friends and neighbors don't get the right services, and I'm sure you don't. And they were able to send me to a 9-day course to get certified. I was also able to go further and test with the Lymphedema Association of North America to be certified on that level. So I'm nationally certified to treat the people I live with in this community. Breast cancer patients are one of our biggest populations, but also wound care patients. And that service is something I think really important. I'm really happy to work into a department where if one of my patients has a symptom, I can say, there is a women's health physical therapist here. They can see you. There's someone who treats vestibular symptoms. They can see you. You do not have to deal with this issue. You do not need to put up with this. We have the support. And I could say that I have, as a student, worked in other facilities as a therapist where I was treating a patient, observing a tech treating a patient, and seeing another PTA treating 2 patients. All were writing my notes. So this was a normal patient load at other facilities. In Ketchikan, I get to work 100% one-on-one with my patients. And that's very important to me because I feel like they get the quality of care that they need. I can also speak as a new mother that I felt very supported in my journey through my pregnancy and in my childbirth experience. And it's not PeaceHealth's fault that this one didn't sleep through the night for a year, but we'll take that one as one of our things. But so I just like to express my experience, and I'm very thankful that I work for an organization that thinks it's important to have these services for our community, so that I can know that my patients get the best of support that they can have. Thank you.
Thank you. Julie?
Let me guess, you don't know how to pronounce my last name. It's Lekua. I am like everyone else here that's spoken tonight. I really appreciate having a hospital. In fact, I was there today and I saw Patricia Thornton, who I absolutely love. But I was asked to share my husband's story. So starting in December of 2017, he woke up with pain shooting up from his groin area. So he went to the hospital and tried to get an appointment. It took him 6 weeks to get an appointment. So he finally gets in to see the doctor, and he's diagnosed with a cyst on his scrotum and a hernia on his right-hand side. So at that time, they referred him to the urologist, which it took 2.5 months or so to get in to see the urologist. The urologist then canceled his appointment and rescheduled it for another time. Now, my husband is an import. I imported him from Nigeria. I am a domestic, he's an import, but we get along great. And so he was very frustrated by this, because when he finally got in to see the urologist spent 12 minutes with him, confirmed the diagnosis. Chima asked for a referral to have surgery in Seattle, because that's what the insurance company kind of said, well, you know, we got to look into this and the cost. The urologist told him, I don't give referrals, and I have a flight to catch. If you have any questions, go back to your original doctor. Wrong thing to say. So Chima started doing research and called the hospital. He spent hours on the phone, and finally, at that point, we were getting really frustrated. Finally, at that point, after hours and hours on the phone, we were told the cyst removal surgery would be $18,000 and the hernia surgery would be $27,000. So together, that's $45,000. Thinking about us having to pay 20% of that, it's over $9,000. So he went back to his original doctor at PeaceHealth and asked for a referral. And asked for a referral. And asked for a referral. Finally, October 14th, now this started in December of 2017, they finally give him a referral letter. And about a month later, we contact the insurance company because they told us it would be probably 45 days before we would get approval. The insurance company says, we never received the referral. And he turned to me and said, I want to go home to Africa. I said, are you kidding? He goes, nope, I'm done. I can't wait any longer if it's going to take them, because if I go back today and they finally give me the referral today, that means it's going to be at least January or February before I get the surgery. And they wouldn't do them both together. They told him that no, that couldn't be done. They had to be done separately. So I just looked at him and I said, well, you're going to have to ask for time off. I said, if you really want to do that. He said, okay. So he went to his bosses at the borough, and they said, what in the world? What's going on here? So his boss starts doing some discovery, and they find out that even though he had a paper saying he'd been referred, the referral was never sent in. So his boss asked him to go back to the doctor at PeaceHealth and ask what the heck the deal was. So they made him make an appointment, and they redid all the exams and all the labs and everything again at a lovely cost to us. So finally, he found out that the doctor said, well, I never gave you a referral. And he says, well, I have this piece of paper. And it turns out that his right-hand gal had given him the referral but never sent it in. So he again asked for the referral. Instead of the doctor, and this was in December, after his boss asked him to do it, the doctor still would not give him a referral. And he grilled Chima about why he wanted the referral, and he said, I don't trust you anymore. I've been trying to get medical care for a year, and I no longer trust you. I just want to go get this done. After 20 minutes of blah, 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 as my husband says, he said to him, I don't need your referral, I'm going home to Africa. Which then sent the doctor off on another tangent about, well, you're probably going to die on the table. Not a good thing to say. So finally, his bosses said to him, we will give you the time off. So it costs us less money for me to send him home to Nigeria, where he had both surgeries the same day, 2 hours. He watched it from a mirror. They didn't even put him fully under. It was less to do that than it was to go back and forth with all the stuff we did at PeaceHealth. Now, as a U.S. citizen and a resident of Ketchikan who was born at KGH, it really disturbs me. My husband is I'm sorry, but he's a very humble man. He works his butt off, and for him to not be able to get medical care, to me was unconscionable. We paid $4,000 for his plane ticket and 6 days in the hospital and 2 surgeries. And it is sickening to me that this man could not get medical treatment here in Ketchikan, that he got jacked around at every turn. He's now to the point, as being a foreigner moving here, many things are very different. But the medical system here is the #1 thing. And I've had lots of issues with PeaceHealth over the year with billing. Crazy stuff. Nothing compares to what my husband just went through. He just got home on Monday night. 68 days in Africa. Because they had told him here he couldn't have both surgeries at once. So he figured he'd have to have the first one and heal a little bit, because that's what they told him to do, and then have the second one. When he got to Africa, his doctor over there said 2 things. One, the cyst should have been taken care of immediately. There should have been, he goes, that is an outpatient surgery. Why was that not done immediately? And the second thing was that his hernia was large enough to where it could have exploded on him. So I feel like, as an Alaskan and a resident of Ketchikan, I love having a hospital here, but it absolutely breaks my heart that my husband had to go home to Africa in order to get medical treatment. And I just think that some things need to be fixed and repaired, and no one should be denied a referral ever. If they ask for a referral, there's a reason for it. And for this man to jump through all the hoops, he saw a PeaceHealth doctor 4 times. 4 times trying to get help and got nothing. So I just implore you, please, some of these things that we're all talking about, I'm not alone in my experiences. My husband is not alone in his experiences. My family has been through the medical gamut for the last 2 years. They all have stories. My brother ended up going south because they couldn't figure out what was wrong with him. He goes to a hospital in Portland. They found out immediately. That's unconscionable. We have a great hospital. We have great people. Many of the people in this audience are people I've known my whole life that work at the hospital. I love them. I think they're great people, but I think we have some issues that just need to be fixed. And I just felt like I had to come share the story because it's a very intense one and it's very personal to me. 68 days without my husband was very hard. And then to get over there and find out that it could have been taken care of and should have been taken care of in February when he was first diagnosed is when it should have been taken care of. And We fought for a year to get him medical treatment and for him to have to travel 12,000 miles to get surgery is ridiculous. So thank you for your time.
Thank you, Julie. That's the end of the list of people that have signed up. Is there anybody else here who wishes to speak at this time? Anybody else? That concludes the persons to be heard, and we'll move into new business. Item A is a discussion between the City Council and PeaceHealth and the Medical Center Community Health Care Board. So at this point, I will move out of the regular session and into a work session. And so at this time, turn it over if you want to start with that.
Well, good evening. My name is Sherry Bowler, and I am pleased to be here tonight as chairperson of the PeaceHealth Community Health Board. It is going on just past 8 years of my involvement in the board. And I've been in Ketchikan 32 years, which is not quite as long as some of the other faces in the room, but I feel like this is my home. This is, when people say, where are you from? I say I'm from Ketchikan. So all of us that serve on the board are called to serve on the board for many different reasons, but I think I can speak for everyone when I say we're united in our commitment to serving the community and the neighboring communities and investing in our future of healthcare in our community. And so that's our primary role in being here on the board, and also tonight is to really engage with you as the City Council. And first of all, I want to really thank the City Council for the partnership that we've had for going on 100 years now. Well, PeaceHealth is going on 100 years in town, and so we couldn't do it without the partnership of the City Council, and we want to thank the community for all that they have done and look forward to having a collaborative conversation tonight. Some of the things, one of the things that is really interesting about the board, do we want to hand out that? We've got an infographic here. As I was saying, we're going on nearly a century of a commitment to the healthcare in Ketchikan, and I won't read all of the numbers on this graphic, but serving our community and the communities of Southeast Alaska, Prince of Wales, Southern Southeast, we have an amazing facility and we have an amazing service line. We have over 500 caregivers that are working with our community each day. We brought 200 new babies into the world and celebrate the births of all these young children. We have 35 different medical and surgical specialties, 9,500 ED visits, over 35,000 outpatient clinic visits this past year, and 162 active medical staff. So the list goes on, and I think the numbers certainly do not tell the story that we're hearing tonight from all the different people that have been here speaking, and so many more who haven't been here or aren't able to make it to tell their stories. But we have a commitment to this community. One of the things as a board member, and I think many of us will share tonight, is why we support PeaceHealth and why we support the work that we do. And tonight you'll hear about some overwhelmingly positive data that we have, particularly focusing on the strong quality and safety ratings that we have here in Ketchikan, the consistent patient satisfaction, and we know that's not perfect every time, but our patient satisfaction scores are consistent. We have really high caregiver engagement, and we have incredible community support. And you'll see the faces of our caregivers all throughout the community, and the ties just go on and on and on in all different aspects. So we'll hear some of those stories tonight. But I want to pass the microphone now to Sister Andrea Nenzel, who will share a little bit about the history of our great partnership.
Well, as Sherry Lynn said, the sisters came in 1923 And the only way that there was service here was because the community worked with them and the sisters collaborated and counted on the collaboration and the partnership of that. In the late 50s, it became very obvious that the hospital on Baden Street just was not suitable. It was a building that needed to come down then, that didn't come down for many years. But this is where it was really important, because even though in those early days it was individuals in the community that worked and supported with the sisters to provide the health care, this was bigger than individuals working together. And it really was the city council who came to the realization that if the community was going to have a hospital, the only way that that could be is with a partnership where the city chose to have the building and the sisters agreed to provide the ministry in that building. And so significant partnership has been in existence for almost 100 years in different ways. And we can only say a very deep sense of gratitude to the entire community and to the leadership of the community that has continued. And before I pass this on, I just want to say thank you to each and every person who spoke to us tonight. We need to hear your stories, and we need to make the adjustments and corrections that are needed. So, thank you. Not sure who's next.
So my name's Ed Freisinger. I've been here about a year and a half, maybe a year and 3/4. And so I'm kind of the newbie. And when I arrived here, there were, I had opportunities to meet with many of you, either individual or as a group, to discuss opportunities for improvement at the hospital. Whoops. Can you hear me now? Okay. And those ranged from concerns and questions around how we were billing, around access to care, which we heard some discussions about, and a couple of other items. And so I want to talk about 2 items here that we've been working on actively, and others are going to talk about some of the others. And that's about our billing improvements. So it was very evident when I arrived here in conversations with many of you in a meeting that our billing challenges had been here for quite some time. And when I learned of them, began working with our team, and what we didn't do at that time was say they didn't exist. We said, we see those, and thank you for bringing those to our attention, and we began working on those actively. And during that time frame, over the past year and a half, we made significant changes to our billing systems and practices. One of them, we heard one of the members discuss that they now have a bill that is understandable. We completely have redesigned our bill based upon patient input so that it is easier to read, is more understandable, and is more complete. We were also hearing that there were concerns that people were going to collections before they understood what their bill was, before they received a bill, etc. We have implemented a new system and process where we have a methodic process where folks are contacted on multiple occasions, and it's up to 150 days if somebody were not to pay their bill that we would be pursuing any collections. But in addition to that, to help people who are having challenges, because we've heard people discuss the challenges with their bill, we've done 2 things with regards to our financial assistance. One of them is based upon using electronic systems. We can proactively help identify who may be eligible for financial assistance, and we can proactively identify, and based upon financial need, discount, or in some instances, completely eliminate copay and deductibles. There's also, when somebody receives their bill, included in the bill is the application for financial assistance. So you don't have to go find it. It's right there. It's available. You can complete it, and you can send it in. And we looked at the demographics here in Ketchikan, and based upon our levels, based on family size and income, up to 75% of the population in PeaceHealth would be eligible, or I'm sorry, population in Ketchikan would be eligible for some form of financial assistance. And so we've been making some significant changes, not only in our billing practices, but also how we're identifying those who may be eligible for assistance. We also recognize that there are opportunities to improve with insurance and address verification. We asked that question multiple times, but sometimes we don't always have, somebody doesn't have a new card, they don't, maybe aren't able to tell us that. We have new software that allows us to help validate insurance is accurate and the addresses are accurate so that people, when they receive them, the insurance is billed appropriately and it goes to the right address in case somebody has moved. We've also have 2 folks that are at the hospital that are focused on addressing billing questions. One of them is Jackie, she's here in the audience, but she's available as well as Ruby to help with people who have questions locally. But we also have a service center for all of PeaceHealth, and we have, working with our caregivers here in PeaceHealth, have developed special training so that they know about the seasonal nature that people work, understand a little more about the culture here, so that there's a team that is focused and dedicated to handling Ketchikan. So we made some significant changes. Is it perfect? It is not. Is it better? It is. And it's something that we continue to engage in and have conversations. And based on that, we are making further improvements in how we manage our billing systems in that. We also know that there's a question on pricing transparency. That's been a topic in the community, and it's a national topic. And a few things on the pricing transparency is there's federal legislation. We do comply with all the federal regulations. And you can go to our website and you can go down to our charge master. So that is fully available on through our website. Now, charge master goes to every single item we charge for in that, so it's probably not all that helpful, but it's the way our system works in terms of how charging is done within that. But also you can go to the website and either electronically request or use the 800 number to call and request an estimate for the service or the care that you're going to require. And again, based upon your financial assistance or financial need, your copays and deductibles may be reduced in those areas. So I just want to make sure or reiterate and reinforce, we recognize that we've had challenges in the past, and we've listened and we've made some significant improvements in that. We know we have some systems opportunities to improve, and we have made significant improvements in our overall operations. And we will continue on that journey for improvement. And to talk a little bit about that, we've got a subcommittee of the board, it's the quality committee of the board, and Bill Tatsuda is our chair of that. And Bill's going to talk a little bit about how the quality committee and some of the initiatives we have going on within the hospital to, again, understand how we're performing today, and based on that understanding, look at how we can get better for tomorrow. So, and it's a process of continuous improvement. So, Bill.
Hi, I'm Bill Tatsuda. I've been on the PeaceHealth Community Board for over 6 years now, and it's been a real learning experience for me. I've been the chairman of the Quality Committee, which quality has become the #1 focus of PeaceHealth, actually, throughout their organization. And before I start, I just want to apologize to Julie for your experience. And I just wish that one of us would have found out about this, because we would have followed up. And in fact, if anyone has a problem with PeaceHealth or any of the providers, the board members and Ed, we're all available. Tell us about it and we'll bring it forward. I mean, this sounds like an awful experience. I'm sorry for that. Sometime last year, PeaceHealth, the main committee of PeaceHealth, decided that they were going to stop looking at expansion And instead, because in the healthcare industry, there's been a huge amount of consolidation. Hospitals are getting bigger and bigger and bigger. And at some point, you realize that bigger isn't always better healthcare. And so PeaceHealth made a decision that instead of getting bigger, they were going to focus on getting better. And their theme is perfect care, zero harm. And they put things into place to try to accomplish that. It's obviously a big challenge. And and some of this stuff is starting to pay off. For instance, Medicare and Medicaid has a rating. There's constantly required surveys that patients get after you visited the clinic or the hospital, and you'll get a survey almost right away. And they're asking, okay, did the hospital always do this? Did the doctor always explain things to you? Did they, when you checked out, did they tell you all the things you had to do to stay healthy? And and you're supposed to answer these surveys. Well, based on these mandatory surveys, Ketchikan Medical Clinic, out of 5 stars, got 4 stars, which means that only 8% of the hospitals surveyed got a higher star rating. So PeaceHealth is in the upper third, approximately, of all the hospitals that were surveyed, and they surveyed 3,725 hospitals. So right there, that PeaceHealth is doing a fairly good job in quality overall. Now, some of the things that they survey was communication with doctors, responsiveness of hospital staff, communication about medicines, cleanliness of hospital environment, discharge information, care transition. And some of the things they do in quality control is continual improvement. So they're always trying to improve. Whenever there's a problem, they try to analyze it and figure out how can we prevent this in the future. Some statistics that show how successful they've been. It's been almost 5 years since they've had a central line associated bloodstream infection, and it's been almost a year since they've had a catheter associated urinary tract infection, which are some of the most common infections you'll find in a hospital. So they've done real well in infection prevention. One of the initiatives they've started has been called continuous improvement. And one of the aspects of that is a method, actually, that the Japanese auto industry used in improving their cars. You may remember back a few years ago that the Japanese quality of cars became so much better than American cars that they almost put Detroit out of business. And even today, Japanese cars have really an edge in terms of quality. And how did that happen? Well, what they called safety stops. In other words, you have a factory. When I was in Japan in the 70s, I went to a Honda plant, and one end of the factory, they were making parts for engines. And so we walked through the factory, and halfway through they were dipping car bodies into paint. And further along, they were actually starting these engines that were hanging on chains. And then at the end of the line, they were driving these cars off the line. And it was a really new factory, and the average age of the workers in this factory was 26 years old. But what they told us was, at any time, any one of these employees, if they saw something where there was a problem with the car, they could stop that line. They called it, and so now the hospital has taken on that concept. And so what the hospital has been doing since November is something called safety stops. And since November, They actually have had 75 safety stops, and each one of these is an opportunity to improve the practices at the hospital. It's continual improvement, and it's pretty impressive what they've done. And it's all because they want perfect care and zero harm. So I'm not sure what else I can say about quality other than it's a continuous thing. It's a focus of our board, and it's the focus now of the entire PeaceHealth organization. And Sister Andrea was the leader of all of PeaceHealth for quite a while. So that's all I have to say.
So, Bill, I got a question for you, and I guess through this process, if there's questions at the time of the parts of the presentation we're doing, I think it's best to bring them up and talk to them. So, as you spoke earlier, you know, and I also appreciate those people that come forward. And one of the reasons why we're in this conversation today is we have people coming forward at our city council meetings with complaints like this, and we try to reach out to PeaceHealth and get them connected and try to figure out what's going on. But do you have a forum or a public meeting where members of the community can come and have input?
I'm going to let Ed answer that.
Good plan.
Well, I think as a part of the process that we're initiating with you all today that may be an outcome that we do put in place. Now, we do have systems and processes for patients or families who have concerns. We have Heartline to the Heart, which is an 800 number they can call, and that's followed up on within our organization. And the safety stop, that is something that actually a patient can ask to be called. They just call the admitting desk and they say, I have a safety stop. And that will immediately start the safety stop process rolling within the hospital. And in that case, the administrator on call as well as another person come into the hospital regardless of the time of day. And we do an evaluation. We ensure that we're putting in what are called, put in steps to make sure people are safe, et cetera in that. But those systems are available today. Yes?
Can you just explain what the safety stop is?
Yeah, so a safety stop is a process in that. And so what it is if something's not functioning the way that a staff member sees or a patient would see, they can call the admitting desk. And they call directly to there. The admitting desk will call the house supervisor, who immediately responds to see what is going on, what's the situation. And we do there's two major things we do first is the patient safe and is the caregiver safe? And then once we understand, are they safe, what steps do we need to put in place to ensure that they continue to be safe at this time? And are there any other patients or caregivers that may be at risk at the same time? Then what they do at the same time, they call the administrator on call in what's called a patient safety responder. We come in and if I'm in the building, I go immediately there. If I'm at home, then I would come in. And we go through, and again, we go through the process, and again, to make sure that we've implemented steps to protect that patient, the caregivers, and others at that time. And then the next day, we do what's called a huddle handoff. And we bring together a team of folks, because at 2 in the morning, maybe everybody's not there. We bring in a team of folks who then, we review the situation, we identify a lead, and then based upon an algorithm we go through, we determine what type of evaluation needs to take place. Some of them rise to what's called a root cause analysis, where we then have a process improvement facilitator, somebody who is certified in lean or process improvement, and then we can go through a half day or even a full day evaluation, or longer if necessary, to fundamentally change our systems and processes.
So can I dummy it down one more time?
Okay.
So I'm just going to give a situation and say, does that fall into what you're talking about? Because to me, it sounds more like if you have an unruly patient, or, so here's what to clarify. So say I go into the emergency room and the doctor is aggressive. I should be able to call that number.
Yes.
Or somebody else should call that number.
Yes.
And then there'll be a team there.
Yes.
So is that number posted in every emergency room?
Not at this point.
Okay.
We're in the implementation phases of it, because we are getting better at it. We're in the process improvement steps.
Right. Okay, so it's basically, if a patient doesn't feel safe or the staff doesn't feel safe.
Right. Or if they feel there's an unsafe situation, or let's say a piece of equipment wasn't functioning properly,
Right.
they may call a safety stop at that time. Our encouragement is if you ask yourself the question, should I call a safety stop or not? Our advice is call the safety stop. We would much rather err on the side of a caregiver or others calling the safety stop to address a situation real time than them not to call it, so that it may in fact cause a challenge for somebody else down the road.
There's one other avenue for community input that we're just rolling out in the clinic side. It's called a Patient Family Advisory Council. They've done a great job of getting those rolling at some of the other PeaceHealth facilities, and we have a new VP for clinic operations, Wayne Hudson, who's here in the audience, but he's charged with getting our PFAC rolling for the clinics, and we're hoping to have that up and running by May. So there'll be several community members asked to join that for community input into the clinic operations side. So.
Go ahead, Dick.
So, talking about the safety stop, and I take it that you're just starting to implement that. My question is going to be, are the patients or their relatives, somebody they're going to be informed of and know that this is in place and they got an alternative? And let me lead on into it. The second part of the question is, Julie talked about being denied something several times. If she'd have been aware of this, could she have said, whoa, something's going wrong, and this wouldn't have happened?
Yes. She could have done that.
Okay, so as long as we this will help, I think, get us where we need to be.
Yep. And you know, I really appreciate that question. How public is that number? I think we need to go back and verify it. We've done a really good job with our staff. I'm very confident our staff knows about it. I'm not as confident that we have we've been real clear on its availability to patients and family members. And that's something we need to go, this is a part of our process improvement.
So if I walk in as a patient, you're going to tell me this safety stop's in place and I can use it? Or am I going to have known that from somewhere? I think they need to be informed. Otherwise, most people in the public, they don't know.
I think we need to get better at that, because I don't think we do it well right now.
So, and we already went through a presentation in regards to billing, so Judy, did you?
Yes, I have a couple of questions just about the community health board and how that kind of works. So are these meetings posted somewhere? Like, is the public aware of the meeting? Are they invited? I guess I just...
Well, we're a private 501c3, so we don't post in the newspaper that we have our board meetings, and they're not open to the public. They are open to all the board members, and so like Carl's a member, and all the people here are all members, and they're as members they can come to whether it's executive session or full board meetings. We do meet every month. Every other month is our full board meeting, and then the alternate months is an executive committee meeting.
So this is actually a PeaceHealth board meeting. It's not a community board meeting. The community's not invited. Is that? I'm just trying to understand.
No, that's correct. It's a PeaceHealth board.
Okay. And
could I just respond to that for a minute?
uh-huh.
I think I can talk about that.
You do, yeah, you got it.
But the reason you're getting confused is because it says community health board.
Right.
The reason we use that designation is because there is one PeaceHealth board, which is the system board. And technically, the Ketchikan doesn't have a board. It has a community made of community members who do certain functions that are designated by the system board. Does that make sense?
It does, sort of. Is this an advisory board then?
No, they have full responsibility for overseeing quality and
I mean, I'm Ron Saxton, and I'm also the general counsel for the system as well as work with the board. The community board may not be the best name for it. It is the local board that is responsible for this hospital, made up of people from this community. And it's not merely advisory. It has absolute authority over the quality issues. It is the body legally charged with overseeing the quality. And so it gets reports, it has questions, it has, metrics, it is responsible. It's the body that has legal responsibility for credentialing who can work in the hospital. So a doctor cannot work in that hospital unless they are approved by this community board, not some other system board. It's the community board that does it. They have some responsibilities over financial areas. So it's a real board with real authority. It's not the board that hires and fires the head of the hospital, but it absolutely is the board that has frontline responsibility over quality, over credentialing, and over some of the financial issues.
Thank you. And I guess my last question is, how were the board members selected?
Basically, the existing board members help pick replacements.
Go right ahead, Gary.
So is there a time limit on board members sitting on the board? I noticed that some people are on there 9 years, 8 years.
That's a current discussion. There are not currently term limits. It's something we're talking about whether there should be, but at the moment there are not term limits.
So for me, part of the discussion is if they're the community board that's in kind of control of the quality control and other things, how do they get their input from the community without some kind of a public forum, I guess, or an opportunity? And I know patient to the hospital is just one of those ways, but as we witnessed at the city council chambers and which we witness here, there are those individuals that may not feel comfortable in that situation. So I guess there needs to be, it may not be involved in your regular board meetings, but at some point, once a month, once every quarter, something, there needs to be some kind of a public outreach so you hear from the community, I think. So that's kind of what I hear. Anything else?
I might make a suggestion, like for instance, the governor's board for statewide independent living and multiple other boards. We have, every third quarter, we have persons to be heard. And also a place for people to send letters, complaints, positive stuff. It's not all negative, but, and no disrespect, but it appears and this is where I think you guys need a public meetings because you're not getting the people coming to you. And that I think is part of the problem.
Thanks for coming tonight, and to the folks who spoke. Pardon me. Of all the things we deal with as city council people, when it comes to things concerning our hospital and healthcare, this is by far the most emotional because it hits close to home for all of us and our families. And I have just a little information for public consumption, mostly a little bit of the dry data just to start. So presently we've spent over $62 million. The folks of Ketchikan, the residents of Ketchikan, have invested $62 million in that hospital. It'll be a little over $63 million when it's done. It'll be a little over $95 million with debt service when the bond expires or when the bond is fulfilled in 2044, which should be just in time for the next renovation. The reason I bring that up is while this can be an emotional topic when it comes to quality of care and things like that, sitting on the council, one lens through which I view this is the folks who put up the money aren't just patients, they're customers, and they expect results. And you provided some data, some quantifiable data tonight on some of the things you got going on, some of the things that you do. That's great. It's good to know these things. It's good to know that you're striving for a continuous improvement process. Mr. Tatsuda referenced the auto industry. How did Honda know when their cars were getting better? Their defect rate went down. Their sales went up. It's when it comes to that part of the discussion, that can be unemotional. That is ink on paper. If we came to you tomorrow and said, what is the error billing rate at the hospital? Would we be told, do you know? If we said, 90 days later, what is the error billing rate at the hospital? It's going to be better, worse, or the same. I'm not bringing this up to cause anybody discomfort or embarrassment. That has nothing to do with it whatsoever. I think these are the types of pieces of information, in addition to some of the things you folks are already providing and striving to improve, that the people who put up the funds to improve the hospital deserve that information. It is their hospital. It's your hospital. It's our hospital. They deserve that information. And when we're talking about disclosure, the mechanism seems relatively easy. I don't know why we don't have this as an agenda item, an update from the hospital board every X number of months from you folks at the city council. The town can come out, those interested can stop by, folks can watch it on TV at home, and they can hear from you folks what's going on. And we can ask questions, and some of them will be pointed, but they're not to point fingers. But I believe that you folks and we and everybody just wants to see things getting better. And I don't think the mechanisms have to be very complicated. And I think from your side, you folks need to be very forthcoming with the things that could be improved. Provide the quantifiable data for that. And I think we're well on our way to having the hospital that we want. And also next time, could we mix it up? This is a little bit of a us versus them.
Yeah. I could have listened to her.
You can make it around.
So what's next, Ed?
So Dr. Christensen wanted to share a couple comments, and then Dr. Rice wanted to talk a little bit about access, because I know that's been another topic in terms of what are we doing in the medical group to improve access to care in that arena. And that's been a topic here, and so Dr. Rice was going to talk about that, but Dr. Christensen wanted to share some thoughts.
I want to just completely go off script and just share some sentiments and feelings that I have in my heart and mind, communicate, I hope that, to the city council. This is my town too. And I am a patient also. And this hospital is really important to me. I want to speak a little bit on behalf of the physicians here and the whole purpose for our existence here in Ketchikan. You know, the sisters brought medical care here almost 100 years ago because of their compassionate drive for our fellow human beings, for one another. As physicians, we went into medicine because we care a whole lot about people, and we've dedicated our lives to try to improve the quality of life for others and use whatever skills and knowledge and understanding that we are able to acquire to help other people. I have only one interest here, and that's to be of service. I think that when we hear stories like Carol's or Julie's, RK's, that tears at us. I don't think anybody here on the board or in the hospital staff is not bothered by those stories. We want to do a good job as providers. We want to make sure we're providing the very best quality medicine we can. And we're making every effort that we know how to make to try to not only provide good quality care and compassionate care, but to continually make it better and better and better. We have a lot of physicians who have applied over the years to come to Ketchikan, that want to come here and practice. But we feel like our standards have got to be higher maybe than other places. And we do turn people away because they don't meet our standards, because we feel like they're not who we want to represent us here in the community. And we look continually for new ways to improve quality, whether it's safety stops or peer review activities or other activities to make sure that we're providing the best care that we can.
Medical care has changed in the last, at least the last 20 years, maybe the last decade. I'm grateful. I was commenting to some of my colleagues just this week how fortunate I have been to practice medicine during the golden age. But the way medicine is practiced today is constrained, often by regulations, by insurance reimbursements. It's becoming increasingly more difficult to provide care like we used to. I don't like it. My colleagues don't like it. But it's the way medicine's evolved. We're trying to do more and more with less and less. I was reviewing some statistics this past week about physicians and medical care. We have today no more physicians in practice than we had in 1980. Yet our population has grown by 25%. And that's not counting the floods, the thousands and hundreds of thousands of illegal people are not counted in our census. We are being constrained to produce more and more. I mentioned to the board earlier, 49% of the counties in our country, in the US, have no hospital. Over 10% of female patients, I'm a practicing OBGYN, have no access to an OBGYN doctor in this country. We are expected next year to be short, just in my specialty, 8,800 OBGYNs in this country. We anticipate maybe as many as 120,000 physicians short by the year 2050. I don't know how medicine's going to survive. I'm worried about it. Because we're constrained to do more and more with less and less. Unfortunately, sometimes the personal one-on-one experience that we used to enjoy seems to dissipate a little bit. I have to tell you that I practice now, I think it's about 40 years. I retired out of the Air Force, and I've had the unique privilege and opportunity to practice all over the world. I've been in Australia, New Zealand, I've been in South America, Korea, England, Italy, and almost every state in this country. I've worked in Air Force hospitals and Army hospitals and Navy hospitals and Indian healthcare hospitals and other public hospitals. And I've worked in dozens of community hospitals and for-profit hospitals. One of the reasons I came here to Ketchikan is because I'm a little bit old-fashioned, and I still just want to be a caring, compassionate doctor. I want to be able to get to know my patients and take care of them and let them feel like they have somebody that they can trust. I could have gone to many other places. I get calls every day, say, would you come join us here, would you come join us there? They need other doctors at other places, but I chose to come here because in many ways I could still, under PeaceHealth, practice old-fashioned medicine. I could take care of patients, spend the time, get to know them, and really care about their problems and help them. And that's not true everywhere. Many hospitals are so driven these days by making some money and a profit in this constrained environment we're now forced to practice in, that their focus is just on numbers, get people in and out, how many can you do so that you can keep the profits up. And PeaceHealth has never done that. And that's why I came here. So I remember I was telling my wife earlier today, one thing I really liked about PeaceHealth is when they came, they told me, it doesn't matter if the patient has insurance, we'll figure out how to pay their bill. It doesn't matter if they can afford it or not. We have charity services and programs to help them. We want to take care of people, and we want to do it right, we want to do it good. I wish we were perfect and didn't make any mistakes. You know, as we become aware of problems like Julie's, we want to address them. That's not acceptable to any of us. But we need to be aware of them to be able to address them, and sometimes that communication has not always been open, so I appreciate your comments. We need to have maybe a better way of communicating. But our hearts are in the right place. We are really trying, and we want to try, and we want to do better. And I'm really grateful to be part of this organization. I wish I could have taken all of you with me the last 2 weeks to some other hospitals. My daughter right now is critically ill in a major metropolis hospital in Florida. This is a huge hospital. You know, we're patients too. I get it, Julie. My daughter is deathly ill. Sometimes this last week I thought we were going to lose her. And we show up in an emergency room, and they're so swamped and so busy that it's 9 hours before they even see us. And meantime, she is screaming in pain, and you have children, you know, or your husband you see hurt, and you want to do something for them, but there's nobody there to take care of them. This is a major hospital. I get a sheet like this, lay it on the floor, and I lay my daughter on the floor for 9 hours and hold her hand and try to soothe her and help her know that I won't let anything happen to her, but there's nothing I can do. I get it. And then we admitted her to the hospital. And for 36 hours, no doctor comes to even see her after she's admitted. Nobody does any blood tests. Until I finally raise a ruckus, and then somebody comes and checks her labs and says, oh my gosh, this is critical. We better put her on the monitor in ICU because she could die any minute. Her electrolytes are so out of whack. For 2 weeks, she has not been able to eat or keep anything down. I'm worried that she's starving to death right before my eyes. We're patients too, and I get it. And that's terribly distressing. And then I had to leave and come back to work to help take care of people here, because that's important too. And now, all I can do is talk to the doctors on the phone, but I'm scared to death. So I can relate, we're human. We're bothered by your experiences, Julie, and Carol, and the rest of you who expressed your comments tonight. But I am grateful PeaceHealth has got their act together, and they understand it. They don't like that kind of experience either, and we do everything we can to make it better. But this is a great organization, and I'm proud to be part of it. And I just want to say a little word about our providers too. In all my experience traveling all over the world and working in all these hospitals, I have never been with a group of providers that I thought were more skilled and more expert and more experienced than the group I have here. I would trust any one of them with my daughter. In fact, I told my wife, how do we get my daughter air-vac? I called air-vac today to see if we could air-vac her from Florida to Ketchikan so she could get some good care, because she's just not getting it down there in that big major hospital. We're not perfect. We have some bad outcomes. Sometimes my patients have had a bad outcome. I'm not happy about it. I do everything I can to make things right if something goes wrong. I care about them a whole lot, whether they know that or not. In this country, we have 350 deaths a day from medical errors. And these are big teaching hospitals, sometimes rural hospitals. But I look at our error rate and I look at our critical complications here, and I think we do a lot better than most places. We're a good hospital. We have good staff. And I'm really proud to be part of this group. And I'm proud to be here at Ketchikan. And I know if I get sick, I have good, competent people to take care of me. And we will work on the problems as we become aware of them. We will fix these things that are broken. Because that's our commitment. So I hope that I could communicate what I feel inside, what I want to share with you. I guess that's all I have to say.
So we've been at this for an hour and a half. Let's go ahead and take a 5 or 10 minute break and then come back. All right, we're reconvening into the work session. Ed, did you have a couple more, I think? Go ahead.
So Dr. Reich wants to share some background on what's going on within the medical group itself. Okay.
Yeah, I think most people know me. My name is Peter Rice. I'm the division chief or medical director for the employed physician group at the hospital, as well as an internal medicine doc. And just a few comments. I'll get to the recruiting in a minute, but again, like everyone else here, I think I was deeply touched and moved by the comments of Carol and Julie and RK, and it's very painful to hear that. One idea I did have that I think it brings us back to community input options is that, for example, Julie wasn't aware of the 800 number, and I think for a typical complaint, well, let me back up. I as a medical director, get incident reports not infrequently, and those complaints or concerns come in a variety of ways. Sometimes they come in on that 800 number. Sometimes people write a letter. Sometimes people call Ed's office and want to talk to somebody. But I think we as an organization should work even harder to make sure that people know that they can do that and how to do that. And one idea I had is just put that 800 number on the bottom of every after visit summary. Every time you go to a clinic appointment, you get a nice handout about your meds, your next appointment. And we can investigate whether we can have that at the bottom, because that's just such a sad story. Interestingly, I think it's okay to share this. There were cultural issues in that story because her husband is an African king. And she kept trying to intervene on his behalf, saying, honey, can I call the hospital? Can I help? And that he wanted to do it himself. And sadly, that slowed things down, because if she'd been able to advocate more aggressively, but nonetheless, that's our responsibility to make sure everyone knows that number. So I guess on to recruiting, just in general, you know, I've been in my position, I think, for about 15 years, and am kind of the center of provider recruiting. It's a team, but I am kind of in the center of it. And I have to say that in general, I feel that PeaceHealth is a pretty big advantage for me recruiting, and it certainly is the reason I've stuck around here as a doctor for 30 years, is the fact that PeaceHealth runs this hospital. And I have lots of friends and acquaintances who are working at hospitals that aren't part of health systems. There are some shining stars out there, but there's a lot of hospitals that are independent small town hospitals that really struggle, because medicine has become so darn complex that doing it alone as a community hospital is very difficult for a variety of reasons. Reasons such as the huge amount of regulatory burden that we all have from the federal government. Things like the electronic medical record, the depth that we need for clinical resources. So all of those are things that PeaceHealth brings to us. The EMR in particular is not a trivial item, electronic medical record. PeaceHealth's big enough, they took the financial investment to invest in Epic. Epic is the most popular and most widely used electronic medical record. And it's complex, but it's probably, of all the EMRs, it's considered not probably the best. If you're at a little tiny community hospital, you get a little tiny off-brand EMR that's often pretty crazy making. So when doctors I'm recruiting, you know, they say, oh, you've got Epic, that's great. You know, that's one example of the depth that PeaceHealth brings to us and makes my job as recruiting easier. We've really, I think, been blessed in the last 3 to 5 years. As many of you know, we've had a lot of instability in some of our service lines in the past. Those would be anesthesia. We've had a lot of turnover in general surgery in the past, along with the tragic passing of Dr. Garcia. Orthopedic surgery, we've had a lot of turnover. And OB, we had a period where a very unstable team. But those 4 teams have been now solidified into very, very strong and stable teams with very high caliber physicians, so I'm pretty happy with that. Our only open positions now, we have, we were able to hire a new internal medicine doctor for primary care, and that's helping a lot with access. We have one more open position there, and we have an active candidate for that. So I'm hoping by the end of the summer that we will be fully staffed in primary care. And even now, most weeks we have very good access with a lot of open appointments at the beginning of every day, which has not been the case in the past. Pediatrics, we have 2 positions open, and I'm going to hear on Friday whether one of the candidate that was here last week is going to sign. He told me yesterday he's 75% sure he's going to sign, so I'm crossing my fingers. And the only other open spot is an orthopedic spot, which is, we've got a wonderful full-time Dr. Becker and then a half-time Dr. Gergroot committed to us for at least a year, but we are authorized to have another full-time. So really our recruiting open positions has gotten to be a pretty small number. And so I think I'm feeling a lot better about it. I guess that's really the things I wanted to get across tonight, and certainly I can answer questions if there are any.
Yeah, Peter. So I don't know what's coming up next, but how does it work with the visiting clinics?
Our visiting clinics, we've done well with that, meaning we have more service lines of specialty services here than most towns our size. We have cardiology for 2-3 days a month, and then they bring Ecotech, we have device managers for pacemaker interrogation, stuff like that. We have telemedicine for the electrophysiology, cardiology, oncology. We have a rock star oncologist who's in person, 3 or 4 days a month, and then telemedicine at other times. Gastroenterology, great guy, same thing. ENT, soon to be 2 ENTs, ear, nose, and throat. And pulmonology is 1 week a month, including sleep. All of those are PeaceHealth providers from other PeaceHealth regions. We have a urologist, as some of you know, who's here 1 week a month. We are trying to get plastic surgery back. That'll be a non-PeaceHealth doctor who's been here before. And then I think there's an allergist who comes not inside of the hospital. So the schedule is posted in the newspaper. I guess that's kind of the general layout. But we have some specialties that, Juneau doesn't have. We have basically a really broad range of specialists for a town of this size coming. And more telemedicine. We have infectious disease telemedicine as well.
So I have one question because it came up to me.
Yeah.
So I know from personal experience that the last place you want to go is the emergency room. And so most people, especially me, but the person who brought this up was when they called because they were not feeling good,
yeah,
and they wanted an appointment, and they were told to go to the emergency room.
Yeah.
Now for me, that's saying now I'm going to pay double.
Yeah.
How do we address that?
Yeah, I'm glad you brought that up because it also relates to that comment about no triage nurse. I think historically we have not done a great job in the past with our primary care access, and I think there have been times, I know there have been times in the past where our receptionists say we have absolutely no appointments, you have to go to the ER because we have no room. We've been tracking that, and I haven't seen the numbers, but we've had months go by with none of those occurrences, and then other months with 1 or 2 because of capacity. Generally what's supposed to happen and does happen is a call comes in, and if it's something the receptionist can't handle or has a question about the medical need, then that goes right to a triage nurse. So we have nurses who are assigned to triage in every clinic. So I'm not quite sure where the system failed that other gentleman, or if in the past there was another nurse I wasn't aware of who was just the triage nurse for the hospital. And it's all very well developed. There's triage books and algorithms that they use and document on, if this, then that sort of stuff. So it's something we talk about constantly is, our access, how many open appointments, and, if anybody was told to go to the ER because of capacity. And, again, that's something I hope to get to 0 always with the addition of another clinician. I think with Dr. McNeil's presence, that's helped us a whole lot. So, yeah, I guess I agree with you. It's a terrible thing to tell someone to go to the ER just because we don't have a clinic slot, because it's double or more. You're right. So, and they're.
Thank you. Anybody else? Can I just add one more thing to what you said? And I'm not the clinical guy, obviously, but part of what we've been doing here and system-wide is really trying to track those things. So they've been anecdotal for years. Now we actually have the statistics. How many people called and didn't get an appointment, and you know what, and so forth. And so, as you say, those are now tracked really carefully. And what we've seen as a result of tracking them is they've come way down once you start focusing on it and saying it. And so there's absolute recognition, not just here, but everywhere. And we are very aggressively tracking it, and we're seeing huge improvement.
And maybe that's data we should bring, you know.
Well, and it reminds me of something. So I recently called my doctor in Harborview. And I don't agree. I actually find Harborview to be an amazing, and Northwest Hospital, amazing group. I get the care I need, I get the answers, and when I get my bill, I get a receipt at the end that tells me they got my payment. I still have no clue if I have a zero balance at PeaceHealth. But that said, one of the things that's great about, like when I leave a message for the nurse for, like, for instance, the bone doctor for foot fusion. It says, if you do not hear from me within this set time frame, please call my boss, so-and-so, at this number. And maybe that's something, that way they're held accountable, so.
I think you just hit the nail on the head. Things are getting better. We'd love to see that data. I think Dr. Rice hit the nail on the head. That's exactly one of the mechanisms that would be beneficial to us as a city council. And quite frankly, if for no other reason, it's in your own best self-interest to tell the town, we're doing this much better. We're never going to ask for anything confidential as far as business strategies, HIPAA, anything like that. But this is the kind of data that the folks who funded the hospital frankly deserve to hear.
So Ed, you have one more. One more? And then, well, Dr. Johnson and Ken, we're going to discuss our community collaboration committee.
A couple of things. Dave Johnson, been here since 1970. When I came to Ketchikan, we had one EKG machine at the hospital. One. We had one X-ray machine. Now we have, I couldn't even begin to count how many EKG machines that PeaceHealth has bought. We have not only 3 fixed, but 2 portable X-ray machines. We have a 128 slice CT machine. We have a brand new MRI that PeaceHealth bought a $100,000 uninterruptible power source for, because the power from KPU kept fluctuating and kicking off $35,000 worth of coolant that had to be replaced. The point being, PeaceHealth has done a phenomenal job of supplying the materials, the equipment, the supplies for the hospital. The city enormously grateful for the wonderful facility, but the city provides the bricks and mortar, and PeaceHealth has provided everything inside that hospital and continues to. So that's a very important piece of our discussion back and forth about responsibilities. The Community Collaboration Committee is something that PeaceHealth corporate has encouraged each of the community boards to put together. And what we are trying to do is to put together a program that hears from the community as directly as we can, from as wide a variety of folks in the community as we can, about what we should be doing. The federal legislation requires a community health needs assessment every 3 years. Well, 2019 is our year. And we are having, PeaceHealth has contracted with an organization to do the community health needs assessment. When it's finally completed, it will probably be a 125 page document of documented needs from the community that we then look at and say, okay, there's 100 good ideas here. We can't do all of these 100. Which are the ones that are most important? And that's then committee work done by the collaboration committee, and then recommends to the board, and then the community board makes the decision about which of those additional, new, different way of doing things happens. And so right now, there will be notice in the paper for meetings related to the community health needs assessment. And I would strongly encourage anyone interested to look for those notices and then let your feelings be known. The point of the Community Collaboration Committee is to help us know the best information we can about what people want the hospital to be doing, and then it's our responsibility to look at whether that's something feasible for us to do or not. As a critical access hospital, Ketchikan General Hospital is in the top fraction of a percent in terms of equipment and supplies. Not very many critical access hospitals have an MRI machine, for example, or orthopedic surgeons on staff. But there are things that we can't do. I mean, no matter how much somebody would like to have cardiac surgery in Ketchikan, it's never going to happen, as a ridiculous example. But the whole point of the Community Collaboration Committee ongoing, and then the process that's happening this year with the Community Health Needs Assessment, is to make what we're doing as relevant to the people in the community as we possibly can be.
Thank you.
Yeah, again, my name is Ken Owen. I'm here by way of Craig on Prince of Wales Island. PeaceHealth has a primary care clinic over there. And so back in 2010, PeaceHealth sought out an individual from the island to represent the clinic over there and the residents, patients over there. So that's when I was asked to join the board and serve on the board, and I've done so ever since. Happily, tell folks I've raised 2 kids and 3 businesses over there, so I've been coming and going for 25 years now. My son was born here. I was medevaced here. Dr. Rice mentioned earlier today over 200 medevacs annually coming over to
incoming 215 into the hospital.
Into the hospital. Probably a lot of those from Prince of Wales, I'm guessing. And so I take it very seriously about attending and representing the island residents, and again, I do so happily. I've served on a number of the boards, the Quality Committee with Bill Tatsuda, and I serve on the Community Collaboration Board with Dr. Rice, or Dr. Johnson and Clay Keene, who couldn't be here. As these 9 years have progressed, healthcare has changed immensely. It's been quite the learning curve for me. It's much different than pizza, what I do back home, or did back home for a lot of years. It's been a whole education and learning experience and an incredible opportunity. So I'm very thankful to be a part of it. As healthcare has changed, so has PeaceHealth, and incredibly so. They embrace the change, truly. I've not seen a more nimble, agile group. I keep hearing system, but when I hear system, I see faces. I mean, I see Sister Andrea. you know, in all these board meetings and all these committee meetings, there's a sister sitting next to us when the conversation digresses into, is it good for the patient? Is it good for care, the caregivers? I mean, they quickly redirect, and we all understand, you know, what is important. And so I really appreciate that, the mission, the culture, the value that PeaceHealth brings to you know, my little town of Craig and the broader, bigger city of Ketchikan, and then, you know, the whole system, PeaceHealth, as a system, you know, it really goes both ways. I mean, we may want to, we are unique, we are individual here in Ketchikan and in Craig. PeaceHealth system knows that, they get it, and when things aren't going the way we think they should, they adjust, they change, they allocate resources, money, people. I've seen it time and time again. So it works both ways, and when you know, things don't just trickle down, things trickle up too. So I'm very happy to be a part of this organization. On the Community Collaboration Committee, this is an amazing outcome. This committee has gotten legs and has made the opioid crisis, it's a #1 aim of working towards and problem to deal with. And so this committee is what collaboration is all about. I mean, there's 15 member organizations at this board that PeaceHealth hosts, and again, PeaceHealth sets the stage and brings these organizations together to try to help the people of Ketchikan and Prince of Wales. There's 15 members, 12 different organizations, and already we've seen results in that we've gone from one MAT, medically assisted treatment provider for opioid addiction, who can prescribe medications to help the patient, to 9 providers now, by, you know, the conversations and the meetings that have gone on over these last months to help. So that's pretty significant. And that's the #1 priority. That committee is also working on alcohol, tobacco cessation, and it's really great to sit around the table with those folks and watch people go, oh, you know, you can do that? Well, we do this. The two get together on a sidebar, and then all of a sudden, patients are getting cared for in the way that is needed, that wasn't happening before. Also, I just want to mention the PeaceHealth Ketchikan Medical Center Foundation. Matt's not here. But just to briefly talk to that, the foundation is the philanthropy arm of the Ketchikan Medical Center, and they do an incredible amount of work at raising funds, and those funds stay right here. They come back and over $5 million in direct gifts and over $10 million in state or federal grants. And one of those grants I know is on Prince of Wales right now, and it has been for the last 3 years. And Andy West is doing an incredible job through almost every town on Prince of Wales, Knockety, Heidelberg, Kaufman Cove, Whale Pass, of identifying what in each community, where can we best, it's basically the Prince of Wales version of the community health needs assessment that Dr. Johnson was just talking to. And that money and those efforts are translating into, you know, they're changing people's lives over there. So it's a significant amount of money. It's $3 million grant, CMS grant. And then just the corporate system giving by PeaceHealth is just, it's just a list of warming shelter support here in Ketchikan, a grant to pay for rent and utilities for 3 years. The Car House building was donated. at Washington and Jefferson, plus a $100,000 donation. Grant for the KWC for Frisbee Golf Course. Advocacy for UAS now offering medical office assistant course here in Ketchikan. Grant to UAS for 7 Ketchikan High School students to participate in Certified Nursing Assistant Program at UAS, again, a grant. Yearly Joseph Shields scholarships for college students interested in pursuing healthcare field. And finally, medical staff grant to support EMT training. So again, it's a two-way street, and it's, I think, being a part of the PeaceHealth community is mutually beneficial. So thank you.
Any questions? You have anything else, Ed?
What's the goal of objective of tonight?
Well, so let me kind of summarize how this came about, I guess, is we had a number of people ended up, as happened tonight, in regards to complaints about whether it's billing or health care in front of the city council. The city council is the landlord of PeaceHealth. And we were really unsure how to handle and deal with those. They were heartfelt. We had concerns. We directed the manager, and a number of times we've reached out to PeaceHealth in regards to some of this stuff, and they responded. And as this continued to happen, the council struggled, and there's a process by which the lease agreement will be renegotiated. I think it comes due in 2023. And so we wanted to get a little bit of an early jump, and actually PeaceHealth came to us and asked about that also. But then the discussion came around to, well, what can we do? Certainly we have no responsibility or authority in regards to medical care. But I believe that the community thinks, since we own the hospital, we provide funding for the hospital, that somehow we have to say in regard to some of the stuff the hospital does. And in regard to some of the things in the lease, it's very vague in subcontracting services and that. So the council said, was there something else that we can do? Is there more? Is there, what do we want this thing to look like? Is there an opportunity to change it from a landlord-tenant lease to maybe some kind of a mutual operating agreement type thing? And as that discussion progressed, it was very obvious that the city didn't have the expertise, and we didn't really understand what that may look like and what the pitfalls of that, as well as if there was any benefits to it. So we directed staff to go out and see if there were contractors available that do that kind of work. So through a process, they brought some names back to us. What we found out is there's very few, and they're very, very expensive. So we hashed this around at the council a number of different times. We had council members that weren't present, so we decided not to do something at that time, and then the cost came up, and let's look at a few different contractors, try to figure some different things out. And there was a lot of uncertainty in what we should do. And for me, I was more concerned about what I didn't know than I did know. And so we finally came to the conclusion, we had some numbers, we thought about the process, and we all understand the first thing that we're going to do is we're going to need a lease, regardless of what happens, right? We're going to have to renew that at some point. And so the council, again, reached out and decided that, well, let's sit down and talk with PeaceHealth. That's what brought us to the table here today. And then I guess the logical next step is we'll go back and consider what we heard today and we talked about today, and then have further discussions about the direction that we want to go. and open up those. We'll be contacting Ed and we'll sit down and talk about that some more. For me, it was good to hear what you've done and what you're doing and what you're planning to do. That helps a lot. And the last thing is, sitting as the mayor, is I don't want to put the city in a position where they have an unknown liability. Our job is not to run a healthcare facility. And I don't think any of us want to do that. But we are concerned about our citizens, and so I think this conversation is going to help us move forward with where those complaints probably come to the correct people. So I think that's where we're moving, in the direction that we're moving. If there's anything I've missed, please fill it in. That's what I see this is. This is that opening discussion where we're looking for solutions. Nothing to say that we're doing what we're doing now is bad or wrong, but I think that we need to review it and make sure that we get on both sides of the table the community's best interest. And that's what we're looking to do. So again, I think out of this meeting, we've got some information, and we'll go back and discuss that and then meet up again. That's what I see. So if there's nothing else, we usually end with council member comments. Dick? Oh. Yeah.
I think, Bob, though, there's a couple items that came up tonight that I certainly want to make sure that we're extending or responding to. One is we are more than interested and willing to engage with the city council on a regular basis, whether that's to come in and do updates on whatever schedule you think makes sense. We're willing to, very interested in understanding how do we build a better communication link, et cetera. So please know that we are very open to conduits of sharing information. And taking from the conversation today also is, how are we then opening our doors a little better in terms of receiving comments from the community, whether it's a quarterly, our board meeting is at this time, from this time to this time is open for people who have concerns to come forward. How do we make ourselves more open from that? We're very interested in learning how to do that better. And so we're going to go back and design some models to do that. But I want to make sure you know that we are very interested in how do we communicate in a manner that provides you with the value you're looking for.
Thank you. Well, Carl, do you have anything for tonight?
No, I think it's been a constructive discussion. We'll be coming back to the council to seek direction as to how you want to move forward with the lease. I would add the comment that access to the public, both through the city council and through the community health board, is going to be critical going forward, because I think the issues that were discussed tonight, just like it's going on the national level, they're going to be resonating in Ketchikan, and that kind of exchange is going to be critical going forward. So that's all I have.
Thank you.
Yeah, I'd just like to thank everybody for being here tonight, and I think it's been constructive for both sides. We've learned some things. I think you folks have learned some things, especially how we communicate with the public, how they communicate with us. You never can have too much of it. And there's some things that were explained, like safety stop. I think that will help the patients especially know that they've got an out if they see something wrong, and that the doctors do. I think the only other thing I would mention is, another comment. One is, we know that the lease on the hospital building is 50, 60 years old with one little update. It does need to be modernized. What it's going to say, I don't know, but hopefully it's just simply a lease, and we move forward with keeping the patients doing where they need to go. Another comment is, Dr. Christensen mentioned the shortage of doctors, facilities, the ER room down there where he got involved in, and we need, I think as a community, if there's a way to find out what the devil is going on, and I suspect it's like you mentioned, maybe it's the federal government, which I don't trust at all, because the legislators make laws and the bureaucrats make regulations and they don't know what goes on. And if we can work together and get to our federal delegation and fix something, let's do it. I don't like sitting around and listening to them go back there and make laws and then dump them on somebody else. So let's work together on that right there and do what we can do. But anyway, thank you again.
I'd like to thank the members of the public that came and spoke tonight. I know for a lot of folks that's not easy. Thank you to the board members who came tonight. It was a real education for me. Learned quite a bit. Hopefully you guys are able to take away a couple of good things from the city council tonight. I'm going to view this as a good first step towards improving communications and hopefully better outcomes for the community. Thank you.
Yeah, I'd like to thank everybody who came out tonight. And one of the things I want to make, maybe just say, my goal and objectives in this whole thing is, let me just, a little history here. 95, May 31st, I ended up in that ER, and I'm alive today because of it. I'm alive because of the EMTs, the surgeon that was on at that time, and I owe my life to a lot of people in that hospital. However, I also see a lot of things that could be better. As a person who has swam through the gamut of the medical arena for the last 25 years, and I think it's always good to get criticism. The one thing I've learned sitting on this council is I get criticized a lot. And I may not like it, but I appreciate it because it makes me think, okay, what can I do better? Or what did I not catch? But I have a list of things. But I think in what I'd like to hopefully get out of this is I know that with all the changes and the cuts to Medicaid, Medicare, our insurance issues are not what they were 20 years ago. I get that. But how do we as a community make it better on our citizens because of that stress alone, and the number of people that are put in the situation of being bankrupt by medical bills, and that's nationwide. But it doesn't have to happen to us. There's got to be a way we can work as a community to one up the outside world, and that's what that's my goal here, is that we are more transparent across the board, be it medical, be it as city council, but also that we recognize that we have citizens that feel disenchanted with the system, and I do too, and I have my own story. But with that said, I'm not going to go into it. But what I really want to see here is us showing the rest of the world how a medical system should work the way it used to work, like Dr. Allen would like to. That's why he got into medicine, and that's what my goal is here.
Thank you. I would just like to say thank you to everybody for coming out tonight. All of your words and comments tonight, to me personally, did more to dispel all of the things that we've been hearing. We haven't heard from you at all. And yet the people that have received your services have, unlike you guys, we meet a minimum of 26 times a year, and we hear from everybody on every subject. I think one of the things that we could do is to have a conduit from the information that we take in from the community, since we are the first line in some cases of the comments that we hear, to come back to all of you and to get a meaningful response back on this is what happened, this is what, you know, what can we do about it, what are the, you know, what can we do to change it to make it different. That will give us something to work with, to come back to the people that come to us, and so we can have some understanding. Right now, it's, for me personally, it's been a black hole, and it's good to sit with all of you tonight. I've got a lot out of it, and I really appreciate and am very proud of the facility that we have and the dedicated physicians and the people that work there that got up and spoke. You did yourselves a lot of good tonight with me, and I appreciate your words, and thank you.
And it's all going to go downhill from there. Sorry, I just had to do that. I'm the one you should be afraid of. No. I like to see that the community board would represent a cross-section of the community. I think maybe if the board met with city council twice a year maybe, and it was public, and people could come here and speak. Like, it was advertised several times. We didn't get a large number of people from the community, but, you know, this is the first meeting. Maybe if other people had concerns, they could do that. I have personally spoken with Jackie Jones-Bailey on a couple of occasions when people have contacted me and come into the mall and wanted to share their experience. But, you know, a lot of people don't want to give us all the information, and I don't want all the information, so it's good to have those contacts. But I think if there's anything I've learned here tonight, it's y'all have to be out there. You have to be meeting and greeting the people. Until I came on city council, I didn't know, well, I knew Bill, but I knew him at Tatsudas. I didn't know who you were. And the community needs to know who you are. They need to feel comfortable approaching you. And, you know, we all have our circle of friends, but I think you just need to do a little better job of getting out there, because you do some great things, and I'm proud to be part of this community. I'm proud to use PeaceHealth. I've had some, you know, for the most part, I've had a few billing problems, but when people talk to me about getting a price and calling that number and doing all of that, it didn't work very well for me. But it didn't not only work very well for me here, it didn't work at the other 5 hospitals I called in Washington. So for people to say that, oh, you know, I called Seattle and I got that, no. And they can't tell me that now because I've experienced that. And so I think that as council members, and we have questions and the community have questions, Ed, thank you very much. You responded to all the questions that I had. And those were questions that people had come to me with. So it's good to have that information. So I just want to say I appreciate everything that you do, and I know that it's not always easy to serve. So thank you.
Yes, and again, thank everybody for coming. And so for my comments, 4.5 weeks ago, my wife had a life-threatening issue. The hospital was 2 blocks away. We get in at 6 o'clock in the morning. She's in surgery by 10:30. She's out of surgery at noon. And the whole process was handled very well. In the hospital for 6 days, the service couldn't have been better. We got our bill and I understood it. It was pretty straightforward. So I think that it's easy, and we see it at the council level too. When you have a disgruntled person and they come and speak to you, that's only one part of the constituency. I think that everybody that goes to the hospital, I don't know how many visits you get a year, the majority of them walk away, you know, feeling good. So, yeah, we're going to make mistakes. We do it on all levels. But I think as long as we continue to try to eliminate those and reduce those, we're doing what we're supposed to do. So, anybody? And then maybe for her.
Great. Well, as the chairperson, I really want to thank the City Council for your comments. We are listening. I think you brought up some really great points that we can take back and chew on and try to figure out how best we can share our stories and our successes and listen for opportunities for areas of improvement. One of the things that we're always telling the system is how special Ketchikan is, and they get sometimes a little tired of hearing us say, well, we're different, and it's different here, and we're special. But all of us in this room, as community members, know how special this community is, and we want to be and have a positive working relationship and look forward to many more opportunities to get together and have these conversations and answer your questions. And sometimes, you know, I know my first 2 years on here, I didn't even know what I didn't know. So as you're looking for data and hoping to get more information, you know, feel free to ask the questions, and sometimes we might not know what you want. So coming up with what you want to hear, and we'll share as much as we can share, and we look forward to having those conversations. Sister Andrea, or do you?
Yeah, let's go around. Yeah.
I just want to say that, like most of you, I've been here a million years. And I've been on this board. I think I'm the senior member. And I asked my brother if he could remember how long I've been on the board, because now that we're both over 60, if we get together, we can usually piece together what we've been doing for the last 20 or 30 years. Anyway, he couldn't remember either, but it has been so long that I've probably forgotten more than I actually remember today. But I just want to say that the one thing that's really clear to me in my tenure with PeaceHealth and with this board, and we've been through a variety of names for this board and responsibilities. We've had, I think I've worked with maybe 4 or 5 different CEOs for Ketchikan Medical Center, and I don't know, maybe an equal number of people who have been in charge of PeaceHealth. And as my friends, the people that have been here with me for as long as I can remember, I just want to assure you that this board, this community board, is probably the best one that I've served with. They're the most invested personally with their time, and I feel the most passion from them. It's not to say that the others weren't good, it's just to say that I think this one is the best that we have. And I have to say also that I think my perception of PeaceHealth as an organization with its current CEO, Liz Dunn, is probably the best that I've seen too, with the least, how do I say it without being offensive to her predecessors, but you know, her background, I believe, is military. She's no nonsense. This is what she wants done. She cares. She makes sure that, you know, we have what we need. And I just think that, bottom line is, I think that things are the best they've been in a very long time. And I'll just mention one other thing, that as the years have gone by, when I first got on the board, we heard a lot of complaints, and you ask where we hear these from. I personally get them because my picture used to be on the wall up there. I think when Ron talks about term limits, it's me that he's thinking about terming out because my picture's disappeared. But I just say that that, you know, bottom line is, I think that we are on a we're moving up and we're getting better, and I would just hope that we could continue to improve, because I think we are. But at this conversation that we're having tonight, I think is a big improvement in communication, and I think what I'm hearing tonight is we all need to talk more so that we understand each other better and what each other is doing, and can better then respond to the public. You folks as well as us. So Anyway, I really appreciate the time tonight, even though it's past my bedtime.
Tina, your photo's still in the lot. You got moved to a different wall, but you're still there.
I guess what I would like to say is, I know Ketchikan is special because I spent 9 years up here in Ketchikan. So I came up in '69 first, and then '71 I came permanently for a while. And I do know that. And I do want to say thank you very, very much for what has happened tonight, because if nothing else, what it says is this is a partnership. Yes, it is your hospital. And yes, these people on the board here are responsible for seeing that it provides the care. And they also hold PeaceHealth as a system to what we need to be about. And I can't agree with Tina more that I was, as was reminded, I was chair of the PeaceHealth board for a long time. And I believe we have the leadership that is turning the ship around and truly bringing us back to where we need to be in serving the people of the communities. So I just can't say thank you enough for opening yourselves to inviting us to meet with you and calling us to hear the community members. We do need to hear them, because if we don't hear them, we can't fix what's going on. And I have to tell you, I've been coming up here a number of times for various meetings, and we heard about the billing. And I would go back and I would stomp and I would do everything possible to get that billing fixed. It's only when you get the right people who can do it and who hear it. And we finally got the right people, and I am so thrilled that you're getting bills that you can understand. Because I agree with you, the bills you get from most facilities, I don't even think a financial person could understand them, let alone the ordinary person. So I'm glad it's fixed. We're going to keep working on the other things. And truly, I can't agree more that we have great people here, and we will work to see that truly it is good care and zero harm. We're going to keep working towards that. And zero harm means in all aspects of the person, not just physically. It means their hearts. And that's what we heard tonight, was there were some broken hearts. So thank you.
Thank you. I want to thank you all for coming and having this meeting with us. I think I wrote you all a long letter about 3 or 4 weeks ago. Hopefully you read it. But I just wanted to reiterate that most of the members on our board grew up here, have been here a long, long time. And we're not on that PeaceHealth board to look out for PeaceHealth. We're on that board to look out for Ketchikan. So you are well represented on our board, and the Ketchikan is first on our priority list. I'm hoping that this meeting, of course, is just the beginning. We know that we need to spend much more time together so you can understand what PeaceHealth is and what it's doing and all the issues they have. And we also need, as a board, to figure out a way to open ourselves up to hear the public, because that's one thing that we haven't been doing, and it's real important. So between the two things, more communication with you guys and more with the public, I think is what I've gotten out of this meeting. So anyway, thank you very much for calling the meeting. I really appreciate it.
Yeah, I can't say it any better than Bill, so I'll just say ditto to him. But I just want Mark to let you know that we do have numbers and statistics. When I got on there 7 years ago, my pet peeve was the ER. My daughter-in-law, 6 hours sitting in there, never seen nobody. So Berto, he sponsored me and I got on this board, and that was my #1 thing. That's got to be fixed. So now monthly, we get numbers. They come from Carolyn Henry there. Bill's our leader, but we everything is monitored in that hospital. And so now when a guy walks in, or a girl, walks in the door to ER, there's a timestamp. We see those monthly of how long these people had to wait. And if it doesn't fall in the parameters, we want to know why. So we do have a lot of that, and I just hope going forward that maybe twice a year isn't enough. I mean, we're going to go back and have meetings and try to see what we can come up with. But it's been a crime over time of the lack of communication between these two groups, which is our #1 employer in the community. You know, we all have experiences up there. Some of them are better than others. Yeah. Thank you very much.
Yeah, thank you for having us.
Again, I just want to thank you all for inviting us here today, and I want to thank our board members for coming in and participating in the discussion. I'm looking forward to developing the approach that meets your needs so that we can communicate more effectively what you're looking for. And so I think it's going to be a journey. I think we're going to try and we're going to find out what works and what doesn't, but I think it is going to be a journey about how we're going to figure out what is the right cadence and what is the right information so that we're able to use that communication really, really effectively.
I just want to say thank you also. You know, we're sort of in the same business. It's a service of our fellow man. And you, council members and mayor, are serving our community. You spend, I know, many long hours, sometimes in your own time, to take care of us. And I appreciate your diligence and your desire to do a good job and to represent the community well, and to represent me well too. So I just want to thank you for the opportunity we had to be with you tonight, and also for your selfless service that you all give as well.
All right. Having no other business before, a motion to adjourn.